Well, good evening, everyone. My name is Mary Brawley, and on behalf of Los Barrios de Amarillo, I would like to thank you all for joining us this evening for a very important community discussion regarding the COVID-19 vaccination. I would like to begin by introducing our guests. With us is our city mayor, Mrs. Ginger Nelson, our city manager, Mr. Jared Miller, our city director of public health, Mrs. Casey Stoughton, Amarillo Wesley Community Center executive director and associate director, Mrs. Liz Rascon-Alanis, and Mr. Jerry Branch. Dr. Martha Mendoza-Zinn with Z Family Clinic Healthcare was going to be with us this evening, but she's not feeling well and is unable to attend. We will also be hearing from a few members of our community, Mrs. Teresa Kennedy with the Barrio Neighborhood Planning Committee, Mr. Raul Rodarte-Suto, I knew I would do that, Mr. Ignacio Abreu, and Mrs. Catherine Massey. Thank you all for being here. Before we begin, I would like to ask Mayor Nelson to open us up in prayer.
Would you join me, please? Lord, we're so grateful for the privilege of living in this city and in this community. You bless us extravagantly. So tonight, we just ask that you would use this time and use this meeting to spread the word about vaccines in our clinic and give us wisdom as we field questions and help this information to get out into the community so that the people we love and want to do life with will get it and can be safer. Thank you for this group of community citizens who love our city enough to work to put on an event like this. May you be glorified in our city, and may our city be blessed because we call you our God and our Lord. In Jesus' name, amen.
Amen. Thank you so much for that beautiful prayer, Mayor. Before I begin with our next item, would you like to say a few words?
I just want to thank everyone for giving us the time tonight. Really, any question is on the table. This is COVID specific, but if you happen to have another city issue, when we get to that part of the program, Casey, Jared, and I are happy to help in any way that we can. We're just grateful for this opportunity. So thank you to Liz and Jerry and Mary for all the work y'all done to put it together.
Thank you, Jared. Casey, would you guys like to say anything? Okay, go ahead.
Well, I'm just thrilled to be here tonight to visit with you and to answer any questions that you might have. Again, just to be here tonight and thank you for having me.
Thank you, Casey. And I would like to remind everyone that this is a community forum for a serious discussion. We ask that all participants remain courteous and professional, and please refrain from negativity or use of profanity. I will begin by allowing our speakers to provide their input and perspective on the COVID-19 vaccination. Then I will read some questions that have already come in from our community. If you have a question that you would like to ask any of our guests, please use the hand icon and you'll be prompted to ask. If you're joining us by phone, please keep your audio on mute until you have been called on. Our discussion should last about an hour. We know that it might take a little bit longer than that, but we'd like to keep it to an hour, and so we're going to begin. So I'd like to begin with Liz. She is the director of Wesley Community Center, and Liz, you have clients from 0 to 99, but I know that you have been talking to your senior citizens specifically about the COVID vaccine. Tell us what your seniors are thinking about it. Liz, you're on mute.
That's so funny. I knew I was going to do that too. So hello, everyone. As mentioned, my name is Liz Rascon-Alanis, and I'm the executive director for the Amarillo Wesley Community Center. And I'm going to do it in Spanish, but hola a todos. Como mencionó Mary, mi nombre es Liz Rascon-Alanis y soy la directora del Amarillo Wesley Community Center, que estamos por la 1615 Sur de la calle Roberts. And one of the things we did at the Wesley Community Center is we met with our senior citizens department and had a conversation with them. Y una de las cosas que hicimos en el Wesley, los juntamos con nuestros departamentos de las personas de la tercera edad para tener una discusión. And findings from the conversation with the seniors, unos resultados de la conversación con estas personas is we found that there is safety and trust concerns regarding the COVID vaccine. So I preocupaciones de seguridad y confianza en la vacuna COVID. So there's no trust that the COVID vaccine is safe. So no hay confianza en que la vacuna COVID será segura. They had no trust that the COVID vaccine was effective. So no hay confianza en que la vacuna COVID sea efectiva. So, and one of the other things that we found is that even with this population, with our senior citizens, is that health literacy is still important. So, una de las otras cosas que encontramos es que educación de salud es muy importante también con las personas de la tercera edad. So one of the fears is the side effects of the vaccine. Is when we talk to them, they were really scared about it. Since some people have underlying health conditions, some are worried that if they were to get the vaccine, that their symptoms would be severe and they would not be able to handle it. So we have a senior citizen who suffers from COPD, which is chronic obstructive pulmonary disease. And she said that she has really bad reactions to vaccines. So she has opted out from getting it. And so otro temor son los efectos de la vacuna, ya que algunas personas tienen condiciones de salud críticas. A unos les preocupa que si reciben la vacuna, sus síntomas serán graves y no podrán tolerar los efectos de la vacuna. So tenemos personas de la tercera edad que sufren de COPD, que es una enfermedad de los pulmones. Una de nuestras señoras en el programa dijo que tienen muy malas reacciones a la vacuna, así que ha optado por no recibir la vacuna. So another senior that we spoke with stated that the speed of the COVID vaccine, the velocity that came out was scary. So there has not been enough research done for them to get it, and they prefer to wait. They don't want to be, as he quoted, the guinea pig. So otro señor en que hablamos declaró que la velocidad de la vacuna COVID salió, daba miedo. So no ha habido suficiente investigación con la vacuna, por cual prefieren esperar, no quieren ir primero para agarrar la vacuna. And one of the things that we also did is we asked the senior citizens who did get the vaccine, why did you get the vaccine? So las personas de la tercera edad que recibieron la vacuna declararon that some were that they were afraid to catch it, to get the vaccine. To catch COVID. So tenían miedo contraer COVID ellos mismos a que quieren ser protegidos. And the Wesley and my doctors recommended me to get it. So el Wesley y mi doctor me lo recomendó. And simply to not die is one senior citizen said. Me dijo, señorita Liz, simplemente no me quiero morir. They received the vaccine because they don't want to find out the pain and the symptoms that come from COVID. And so recibió la vacuna porque no quieren saber el dolor y los síntomas que vienen con COVID. And they received the COVID because they do have underlying health conditions. Sí recibieron la vacuna porque tienen condiciones de salud preexistente. So I do believe that from having a meeting with our senior citizens who attend a structured program like the Wesley Community Center Senior Citizens Program, we're more apt to get the vaccine versus those who weren't. So because after talking to our participants, 77% of the senior citizens had received the vaccine, and 60% of the 77 used Wesley transportation to get the vaccine. And two of the conversation drove themselves. So personas de la tercera edad que participan en programas como el Wesley Community Center, el programa de la tercera edad, obtienen la vacuna a aquellos que no son. So después de hablar con nosotros de los participantes, 7% de las personas de la tercera edad han recibido la vacuna y 62% de ellos utilizaron el transporte de Wesley para recibir la vacuna. So, and the senior citizens, when I had a conversation, they just wanted me to thank you all for having this conversation and for providing the sites, the vaccination sites at the Civic Center, and they wanted to say thank you for that. So, las personas de la tercera edad en nuestro programa nomás les querían decir gracias por sus esfuerzos en la creación de los sitios de vacunas. Gracias.
Wow, that's Liz. I mean, I'm blown away. That's amazing information. I don't know if Casey or any of our city leaders, if you have anything to say to that, but you know, it really is interesting that they had so many trust issues, especially because, as Liz mentioned, the speed of what this vaccine was created was one of the scary parts. We all know it takes a long time to create a vaccine, but this one was created quickly. So can you speak to that?
Absolutely. That's certainly one of the concerns that we hear a lot, and it's a valid concern. But one of the things that I will say, I'm going to let Marcus kind of catch up with me, because I know that I'll certainly need a translator. So I'm going to let Marcus catch up with me real quick.
So, lo que ella nomás dice que sí es una cosa que sí los concierne mucho, lo que piensan, y queremos estar aquí por las respuestas que tienen.
So it's a very valid concern. Speed. So there's always three things that we think of when we are considering as science is making a vaccine.
So siempre hay los riesgos, y a veces, como pues sí fue hecho muy pronto, sí, siempre hay tres cosas que necesitamos saber.
There's always time and money and safety.
Siempre es el tiempo, el dinero, y también la seguridad de la vacuna.
Most of the time, as a society, we don't want to give up money, because it takes a lot of money to create a new vaccine. In this situation, and so usually we don't want to give up money, and so it takes a lot of time to give up vaccine, because we can never give up safety.
Una cosa que es muy importante siempre cuando están haciendo una vacuna es el tiempo y el dinero. Y más bien así el dinero es muy importante, así que conservamos, pero también a la misma vez tiene que ser seguro.
In this situation, we had a lot of knowledge because there was vaccine that was there were vaccine research that was conducted for SARS and SARS and MERS that was conducted.
Okay. So, sorry, I'm just trying to remember what case as I'm translating it, but
We had a head start on the research, Marcos.
We had a head start on the research because of SARS and MERS.
Sí, so lo que tuvimos esta vez, y mucha gente así se preguntan sobre la vacuna y por qué salió así muy pronto, muy apresurado. Pero también tenemos que recordar que hay muchos científicos que han trabajado mucho en vacunas por todos los años. Y tuvimos mucha experiencia con el SARS y con
MERS.
MERS.
So in this situation, we did not have to give up much time, because we couldn't give up time. It's a race against time. And we didn't have to give up money, because we had a lot of government funds going into this project, and we never give up safety. So those were the three legs of that stool.
So, lo que pasa es que esta vez no tuvimos que esperar tanto tiempo, porque ya todos los todo. Help me, Liz.
What was the word?
Trying to think, sorry. So, I apologize. One of the things we didn't have to wait for is that there was already a lot of science. Oh, why am I? Sorry. So una de las cosas que no tuvimos que esperar esta vez, porque ya había muchos científicos que habían trabajado en las vacunas en el pasado, y nosotros ya tenemos todas las respuestas que necesitábamos para sacar esta prueba, y por eso también podemos asegurarnos que es seguro. My apologies.
Thank you, Marcus. Thank you for translating this important information. Casey, again, towards the end of Liz's talk, she was also mentioning that the number of people, senior citizens that went and got their vaccination because of the Wesley, because they had somebody there to talk to and to help them through and understand everything that was going on. Plus they had transportation. We all know that transportation is a big issue. So I guess the question is, what is the city doing with other organizations like the Wesley to kind of disseminate this information and work with them to get their clients to the Civic Center?
Absolutely. First, we could not appreciate the work that the Wesley does more.
So, al principio no podemos así agradecerles más, sino el trabajo que están haciendo ahí en el Wesley.
You know, it makes a lot of difference for people to have a place that they can ask those questions and they can have a good solid answer and a trusted resource, just like the Wesley is.
Es muy bueno que la gente así tiene un lugar como el Wesley, donde ellos pueden ir a preguntar y tener confianza en estar preguntando estas preguntas que tienen.
So we're also working with groups like the NAACP.
También estamos trabajando con otros como el NAACP.
And our city transit department is offering free rides to anyone in our community who needs a trip, needs a ride to either the vaccination center or to be tested for COVID.
Y también estamos trabajando con nuestro departamento de tránsito, así para poder ofrecer transporte gratuitamente, así para venir para acá para las vacunas y también para hacerse una prueba gratis del COVID.
And they can call 378-3095 to schedule that test or to schedule the ride for their test or their vaccine. And that's 378-3095.
So, también pueden llamar para hacer una de esas citas, así para que les pueden así organizar así el transporte. Y voy a dejar el número aquí en los comentarios.
Great, thank you so much. Casey, one other thing that I think that I heard Liz mention was the seniors were worried about the cost. And right now, the vaccination is free and both vaccinations are free. How much longer will that last though? Do we know?
You know, I don't. We don't have any indication that that will change. The federal government is purchasing those doses of vaccine. And so we don't have any indication that that will change. So certainly expect that to be free for some time.
So, ahorita no tenemos ninguna indicación que estas vacunas del COVID van a ser cobrados. So, ahorita nosotros estamos agarrando nuestras vacunas del gobierno federal y desde ahora no ha sido nada que van a empezar a cobrar por las vacunas. Ojalá que así siguen gratis por un buen rato.
Well, we know that free things don't last forever, right? Okay, so next I would like to call on Jerry, the Associate Director of the Wesley. And Jerry actually has talked to the parents of the kids that go there. Some of these parents take care of other family members and the elderly. So Jerry, talk to us about what the families are saying.
Sure, and I'm going to be really quick. So I interviewed 35 parents and 4 grandparents, and only 3 of those had gotten the vaccination. So I wanted to dig a little deeper after I heard Liz's information with our seniors, how they were willing to go get it once they had the transportation and the help. I was going to wait for Marcus because my Spanish isn't very good.
Oh.
I'm sorry.
No, it's okay. So, sorry, I wasn't necessarily listening to everything. So say that one more time for me.
No, that's fine. So I interviewed 39 parents and 4 grandparents, and only 3 of those had the vaccination. So after hearing Liz's information, I wanted to kind of dig deeper because I knew our seniors were willing to go.
Okay. So, lo que estoy viendo es que él ha entrevistado 38 personas, de la tercera edad. Y él nomás después de oírle a Liz estaba un poquito interesado a hablar poquito más en ese tema.
And so when, they gave the same answers for their parents. I asked them, do y'all have parents that live with y'all, depend on y'all for transportation? And 24 of them said, yes, their parents are really close with their kids every day. And so they had the same reasons. It's scary. They don't trust it. We don't have no way to get there. But after you dig deeper, I told them, hey, what if Wesley could arrange that? What if we could arrange a time to get you there, pick you up and do all that? Would that make you more likely to get it? And every one of them across the board said yes. I mean, and these people, most of those people were like, no, we're not getting it. We don't know enough about it. But once we threw that carrot out there, hey, what if this could happen? And we could make that happen. They were all on board to do that.
So casi eran las mismas preguntas y las mismas dudas que estaban preguntándose si es seguro, si no se van a enfermar de esta vacuna. So, lo que le hizo interesante es que ya después que habló con los hijos de los papás, tenían casi los mismos preocupaciones sobre la vacuna. So, habló con ellos así casi queriendo decirles, si había un lugar donde se podrían juntar y llevarlos para traerlos aquí al centro cívico, que sería algo que, les gustaría hacer.
And one of the reasons why the people that did get the vaccination was because it was plain and simple. They can't afford to miss work. They were more worried about getting a positive test than actually maybe getting ill. And because they did not want to test positive, so they did get the vaccination. And I spoke to a few of the parents because I had my second shot Monday. And I did tell them that, hey, we can make this happen and get you guys out there, because our neighborhood here, I've talked to so many people that have not got it. And so I want to work with the city here at the Wesley, and we want to do our part to help get that going.
Una de las preocupaciones que más tenía la gente y por qué se vacunaba era porque temían que si no se vacunaban, tal vez perdían trabajo si se salían positivo en una prueba del COVID. Así tendrán que estar en cuarentena y mucha de la gente no quiere estar en casa, necesitan trabajar. So preferían, lo más fácil, agarrar la vacuna así para ayudar a prevenir que se tendrán que quedar en cuarentena y faltar al trabajo, que es una de las preocupaciones así mayores de la gente. Y lo que dice es que es algo bueno que quiere hacer por la comunidad y le da mucho gusto que pueda ayudar a la comunidad arreglando algo así por ellos.
And the last thing is that, so this is not something we talked about, just something me and Liz kind of threw around. Later in the process, if a site like Wesley was a vaccination site, would they be really confident in coming here to get that vaccination? And they were like 100%. Well, of course. So just, that was another thing we talked about. But other than that, we really appreciate everything. I went and got my shots, and it was a great process and quick. And really appreciate y'all taking care of my parents and the rest of the people of Amarillo.
So Jerry nomás estaba diciendo que él y Liz, la otra cosa que estaban hablando entre ellos es que si en el futuro el Wesley se hiciera un lugar donde podrían hacer vacunaciones, que la gente así sería muy dispuesta a ir para allá por sus vacunaciones. Y también quiero agradecerles a todos y también por el proceso que están haciendo aquí en el centro cívico, porque él vino hoy el lunes a agarrar su segunda dosis. Y también quería agradecerles cómo ayudaron a sus papás también.
Casey, can we stop right there and just, Mary, answer that question, why we aren't doing small clinics around the city right now? ¿Por qué no hacemos clínicas más pequeñas sobre la ciudad ahora?
Yes, it takes an army of people. So it takes a team of people to give the vaccines.
So así, dando las vacunas así, lleva todo un equipo así completo.
It also takes very strict storage and handling of the vaccine itself.
So también tiene, como se lleva la vacuna, también como uno cómo se guarda la vacuna y cómo está transportada también es algo muy especial que necesitamos cuidar.
And so right now we, just due to staffing and supply limitations, it's difficult for us to take the vaccine very far from our Civic Center team.
So por ahora, como es poquito muy difícil con nuestro equipo y la cantidad de nuestro equipo y también de los dosis que tenemos disponibles así con la vacuna, es poquito difícil ahorita hacer esas clínicas más pequeñas.
As our supply increases, and hopefully that will happen, sometime, and we certainly want to work with all of our community partners to make that happen. Continue to work with Liz and our other partners, and when that happens, then we'll certainly be able to do so.
Ya después de asegurar más dosis de la vacuna, claro que queremos así trabajar con nuestros compañeros así de la comunidad así para más clínicas así, más chicas así por todas las comunidades de Amarillo.
Thank you. Thank you for explaining that. And you know, it seems like I know that you guys are providing transportation, and Casey, you shared the number, but it still sounds like, you know, people still are needing transportation. So I wonder if there's got to be a way that we push that message out more, especially to, it sounds like the Hispanic and other communities, that this is available. Who is providing that transit? Is it the local bus, or who is doing that?
Yep.
Yeah, so
Amarillo
that-
City Transit, or go ahead, Casey.
You're fine, go ahead.
Well, Amarillo City Transit is providing free transportation right now for vaccinations, for testing. If you call 378-3095, it's 3095, right? 3095.
Yes.
They will set up transportation to and from. They may need you to go to a bus stop, but they'll set up transportation to and from your test so that you don't have to. Transit shouldn't be a reason to not be able to get a test or to get vaccinated. So they'll make sure you can get to and from the testing site from wherever you are inside the city of Amarillo. So, and that's something that the Federal Transit Administration has provided us funding to make sure that we have the capability to do that. So we're doing it. The challenge is getting the word out to people who need that assistance so that they can get the vaccination. You mentioned someone with COPD who was concerned about the safety of the test or of the vaccination. But the person with COPD is one of the most at risk of all the people out. Anybody with a respiratory issue, and COPD is one of the worst or the most challenging, is the most at risk of the disease of COVID. So the vaccination, yes, there's a little bit of unknown, but it's of the 50,000+ that we've done here, we have not had any serious adverse reactions. So there's the very, very, very minimal risk. In fact, no demonstrable risk from getting the vaccination, but there's a very serious risk of not getting the vaccination, which is, all of the adverse impacts of getting COVID when you have all of these compounding effects. And COPD is one of the most challenging, a real respiratory issue. So we want to make sure that all that to tie back around transit, we want to make sure that from a transportation standpoint, that's not a barrier. So 378-3095, we'll make sure they can get there to the vaccination.
Thank you, Jared. Thank you so much for that. Marcus, did you want to add anything to that in Spanish?
That was a long answer for Marcus to put in Spanish. Sorry.
So, el transporte está siendo ofrecido por el Departamento de Transporte por la Ciudad de Amarillo y es completamente gratis. Nomás tienes que llamar a 806-378-3095 y solamente tienes que ir a un lugar o ahí te pueden también levantar en la casa y te pueden transportar aquí por una vacuna. También pueden arreglar transportación, hacerte una prueba del COVID también que estamos haciendo, y esos servicios son completamente gratis. So, no hay razón porque la gente no puede venir y no hay ninguna razón porque el transporte es un problema.
Thank you, Marcus. I just think it's important. I know that you've said that before and we keep saying that, but I think it's really important that people understand that there is a ride available to them to the testing site and back, and sometimes it just takes us hearing it and hearing it again. So I appreciate you, Marcus, for repeating that. I'd like to move next to Miss Kat Massey. She is going to give her perspective. She was also vaccinated. And so, Miss Kat, will you please tell us why you decided to get vaccinated?
Yes, I would love to. Marcos, would you like me to talk? I can talk at a good pace for you.
Sure.
My reason for vaccination right now is my family and my health. I am expecting my second child in June. When the vaccine first came out, I was still fairly new in my pregnancy and was dead set against it. I didn't want to cause any harm to my unborn child.
So, la razón por qué se puso la vacuna, la mera razón era por su familia y porque ahorita está esperando el segundo miembro de su familia. Y, ella también tenía muchas preocupaciones al principio y al principio no se quiso poner la vacuna porque también tenía muchas dudas sobre la eficacia de la vacuna.
Yes, and with that, my husband brought up, I was dead set against it. So my husband brought up a few good points. You're not only putting yourself at risk, you're putting us at the risk of losing yourself, losing you, losing our unborn child, and then leaving us alone. So that got me to thinking, maybe I need to reconsider.
So, al principio, como ella dijo, no se quiso poner la vacuna. Luego habló con su esposo, que también le dijo que no poniéndote la vacuna, también no solamente te está arriesgando, pero también a nosotros, a perderte y también un miembro de la familia posiblemente. So, solamente hablando con su familia, también cambió su opinión en cómo miraba esto.
I do have other underlying conditions. I have asthma and I am overweight. So adding the pregnancy would be a third underlying condition. I visited with my doctor. She said it was a personal choice. I took that. And then I visited with my previous doctor from Dallas because I moved here. And she said, you should absolutely do it. And that was one of my driving factors. And then I also spoke with another woman in Amarillo who was pregnant and received the vaccine.
So, Kat al principio estaba diciendo que sí tiene otros problemas médicas, como el asma, poquito sobrepeso y aparte de eso, recién embarazada. So, sí tenía cosas que le preocupaban. Primero consultó con su doctora, que le dijo que era su decisión personal. Luego habló con otra doctora que dijo que era posible que sí, que era algo bueno que necesitaba hacer. Y luego habló con otra amiga que estaba embarazada, que ya se había vacunado, que también le ayudó a hacer su decisión.
And with the information I gathered from those two doctors, talking to my husband and my friend who was also expecting, I made the decision to go ahead and get the vaccination. I am confident in my decision. I'm protecting myself, I'm protecting my child, and it will guarantee that I'm going to be here for them in the future should I get sick. So with that, I'm ready to get my second shot.
So ya después de consultar con los dos doctores y con su esposo y la amiga, ya tomó la decisión que se iba a poner la vacuna para protegerse a ella, así para garantizar su futuro, que ya estaba lista para ponerse esa vacuna, porque ya estaba segura que era la decisión correcta que ella necesitaba tomar.
Thank you, Kat. That was really good. Casey, do you have anything to add to that? Do you have any stats for us or anything about being pregnant and getting it?
You know, I think I think Kat's decision is and her description of that is beautiful.
So ella creía que la decisión de Kat era muy buena y la descripción de eso también era buena.
And the choice to and the opportunity to be able to protect herself and her baby and her family. She's so fortunate to be able to have made that decision. And I'm glad that we're here in Amarillo to be able to give her that vaccine so that she can protect herself.
Era muy buena decisión que hizo y también era muy afortunada tener así la oportunidad que nosotros estamos ofreciendo aquí ahorita en Amarillo.
Thank you, Marcus, and thank you, Kat, so much, and Casey as well. Next, I would like to call on Teresa Kennedy. Teresa is with the Barrio Neighborhood Planning Committee, and she has an underlying condition, and we'll just talk about what made her decide to get the vaccination. Miss Teresa?
Can you hear me?
We can hear you.
Hello?
Hello.
Good. Thank you for this opportunity. I do have an underlying condition of diabetes and being overweight. I'm also Hispanic. So those are three kind of issues that I had to look at. And I waited a while to get the vaccine for a couple of reasons. One was because I'm afraid of needles and I didn't want to do it. to see anyone give me a vaccine. And the second reason was I wanted to give an opportunity for more senior citizens to get that vaccine before I did. However, my husband has COPD, and as Mr. Miller mentioned, it is one of the most at-risk health conditions in getting COVID. And so I knew I needed to do it for him, and my husband is my why, for why I went ahead and received my first vaccine on Monday. When I went in, it took literally from when I walked in to when I got in my car again, it took 30 minutes. And it allowed me, I even let the nurse know that I was nervous and not comfortable getting a shot, didn't like needles, and asked her if she was really good at giving the shot. And she said, "What do you mean?" And I said, "So that it doesn't hurt." And so she's talking to me. And as she did it, then she said, "Okay, we're done." And I didn't even realize she had done it because I barely felt it.
Teresa,
And so I went to the waiting room.
Teresa, can we allow Marcus to dissect that a little bit?
Sure.
Thank you. I'm sorry, Marcus.
It's okay. So la señora Teresa solamente estaba diciendo que cuando vino ella a agarrar la vacuna, también ella tenía que ver ciertas cosas. También la señora Teresa tiene diabetes, también tiene poquito sobrepeso y era hispana. So eran las tres cosas que también ella miraba cuando ella estaba pensando ponerse la vacuna. Al principio, ella quiso oportunidad a gente más grande de edad, así poner la vacuna primero antes que ella. Pero también tenía sus dudas. Pero dijo que sí vino a agarrar su vacuna al fin. Y desde que llegó hasta su carro, dijo que duró solamente 30 minutos.
Thank you, Marcus. Go ahead, Ms. Teresa.
So when I left the center and came home, by that evening, my left arm was sore, and I noticed my shoulder was a little sore. And then it was sore the next day. And then by Wednesday morning, I was fine. It felt great. So I'm glad I did it. The staff with the health department was very friendly. They were helpful. It went by quickly. When my husband did his, and he's had both vaccines. He just had a sore arm, but nothing else from that. And so since he's over 65, he was really glad that he received his shots, his vaccines as well. And I'm ready to do my next one in about a month.
So la señora Teresa está diciendo que después de la vacuna, después que se fue a casa, poquito más esta tarde, que estaba poquita dolorida así del brazo y poquito del hombro los días después, pero se le pasó. Y ella dice que también está muy agradecida con todos los trabajadores del Departamento de Salud que estaban trabajando hoy ese día aquí en el centro cívico. Su esposo también ya agarró sus vacunas y también lo mismo, que también tenía el brazo poquito dolorido, luego se le pasó y está ansiosa de llegar para atrás por su segunda dosis en unas 2 semanas.
Thank you, Marcus. So Teresa, I have a quick question for you. I think that the vaccine, and I could be wrong, Casey, you might need to set me straight, but I think the vaccine has been available since December. You just decided to get it now, so it's been a little over a month and a half. Was there any other hesitation besides being afraid of needles that you might have had?
I really did want other senior citizens to get it before I did. I wanted them to have that opportunity. And I know several thousand have. And so I was willing to wait for that. But then I knew that my husband had COPD, and I thought I can't risk getting exposed to COVID because we have been social distancing, wearing our masks continuously. We hardly go anywhere, having deliveries done to our home. So I wanted to be sure that he stayed safe. And in order for my husband to stay safe, I need to stay safe.
I think Teresa summed it up very beautifully.
Yes,
Thank you,
thank you. Thank you, Teresa. Okay,
welcome.
next we are going to move on and get a male perspective. Mr. Raul Rodartes Schuto is next. You are on mute. There you go.
Here we are. Well, first of all, thank you guys for having this and providing this for the community. Marcus, I'll go a little slow, but I also throw in some Spanish in there too, because we'll team up here. But wanted to kind of mention that I originally did not want to get the shot, but it was more, it was less for fear of a shot or anything like that, but more of that whole guinea pig idea that was brought up earlier. This idea of like, well, the process is fast, and I don't know if the science is keeping up with it. How much of it is true? And then you bring up those questions. Primero no quería agarrar los shots y no le quería agarrar el vaccination y todo eso, porque pues no sabía si era de veras. No sabía si iba a trabajar, estar muy rápido, cómo va a trabajar así. As time went on, though, kudos to wives. Muchas gracias para las esposas. She is great at researching, and so we actually would have conversations about the vaccination, about the shots, about the process, and look for that information. And that's why things like what we're doing tonight work so great. Marcus, you take that one.
So dijo que al final, después que decidió que se iba a poner la vacuna, que decidió que iba a ser algo muy bueno por él.
Yes. So the research seems to be okay. I felt like Teresa, I'll let other people have it ahead of me, even though, yes, I do have asthma, I do have some other issues.
So después de... Oh.
Go ahead.
Nomás iba a decir que Raúl pensó que después de toda la investigación que había hecho, que él pensó igual como la señora Teresa, iba a dejar la gente más mayor así, aprovecharse primero de la vacuna que será disponible.
But as time went on, more and more people close to me started getting COVID. And it went from something you saw on television to something that was happening within the family.
So Raúl está hablando más así como él empezó a ver el virus y cómo empezaba a afectar la gente que le rodeaba, como sus familias y amigos y cosas así, que ya no era algo así que solamente miraba en la televisión, también ya lo estaba viendo así en la vida real.
And our culture, like other cultures, tend to really push that whole family aspect where you want to gather in groups. And that became an issue because the more people you have, the more different views people have about COVID, about the shot.
So Raúl dice que nuestra cultura es tradición así juntarse así muchos y juntarse así con amigos, y luego es cuando empezó a así escuchar más así sobre la vacuna y sobre las cosas así.
Sí. And so little by little, I think a little bit of the machismo, that whole male attitude toward shots or toward vaccination or taking care of myself. We are famous, males are famous for not going to the doctor.
Raúl dice que también en la cultura el machismo es otra cosa también, que él dice que al principio era una de esas cosas que él lo pensó, los hombres casi no van al doctor, ellos no agarran vacunas, que eso también era otra cosa también que tenía que hablar con sí mismo.
We also have to take care of the family, so our focus was, I don't want to get, even within our family, some of the ideas was, well, if I get tested and I get shown that I do have COVID, I can't work. And that affects the family, that affects the money, that affects what maybe the male of the family is able to do for their family.
Raúl habla más así sobre la cultura y los hombres y su lugar en la familia, el trabajador, el que hace el dinero. So, también otra cosa así, de ir al doctor y hacerse una prueba y que si sale positiva por el COVID y luego no podrá ir a trabajar, no podrá así mantener la familia ni traer comida. So, está hablando mucho de eso, así de la cultura.
And so as I was battling and family was discussing all these different things, my mother and my dad got COVID, and they're up in age. Um, uh, Go ahead and touch on that real quick, Marcus.
Okay. So, Raúl nomás estaba diciendo que era una cosa así que, él estaba batallando mucho con su familia. Luego resulta que los papás de Raúl salieron positivos por el COVID.
We thought dad would have the roughest time, but then my mom, she had the hardest time with her lungs, and it got worse and worse. And within a short while, her body just gave out, and she did pass away.
So, Raúl solamente está explicando de lo que pasó con su familia, que su papá al fin, se superó así del virus, pero pobremente su mamá luchó mucho contra el virus y luego al final ya su cuerpo ya no puso y falleció.
The nurses up at the hospital were amazing. I can't talk any better about them. But it did bring the whole question of like, what is our responsibility, our personal responsibility, not just as a whole family, but our individual.
Raúl dice que su experiencia en los hospitales con las enfermeras era muy, muy buena y los agradece mucho. Luego después se pone a pensar que es nuestra responsabilidad en todo esto.
So I wanted to do our family, we've decided, that we would take action and be proactive and try to get ahead of things, and put the machismo, put the scare of being, out of work or that aside, and just take a plunge and kind of do a faith thing to get our shots and help our economy and our local job time get better. Because if I'm afraid to get COVID and not work, wouldn't it be better for everybody to be a little bit more proactive and things get opened up easier and so that I don't know. I'm sorry to ramble, so you better jump in there, Marcus.
So, Raúl dijo que después de la pérdida de su mamá, que su familia sí se juntó y al fin dijeron que vamos a hacer esto, tenemos que hacer la diferencia, tenemos que vacunarnos porque lo que nos pasó ya no se puede pasar. Decidieron que se iban a vacunar. Go ahead, Raúl.
So we chose to do it, and I had already my second shot. My arm was sore, just like you get after a shot. I didn't get too achy the rest of the week, which was great. When my wife got it, she did get a little achy and was in bed the next day, just resting and kind of getting through it. I've had friends who've gotten shot and been like me, to where we didn't feel very much the next day and we were just sore. And my sister-in-law and her nurses, she's a nurse as well, and theirs was a little tougher. Everybody responds to it differently, but one few days of that compared to what, say, my family and even my mom went through, there's no comparison.
So Raúl también habla así después que sí se vacunaron y después que nomás estaba un poquito dolorido al brazo y su esposa también casi pasó por lo mismo. Pero también dice que todos reaccionan así diferente. Como tenían así amigas así que eran enfermeras que pasar un poquito más diferente. Pero dice que vale la pena en vez de pasar algo más peor como perder su mamá.
Yeah, thank you guys for having this. This is great information to get out, and thank you for the opportunity for me to share, you know, as much as we can for our family and for our economy. Thanks.
Raul, I just want to say thank you. Thank you so very much. I offer my condolences. I'm so sorry to hear about your mom's passing. I think you shared so much valuable information. I could go on and on, but I want to let Casey or Mayor or Jared, do you guys want to talk about any of that?
I want to say thank you, Raul, and I'm so sorry for your family's loss. It costs us when we don't go and get the vaccine. It costs much more than we want to pay. So cuando nos faltan hacer usando la vacuna, el precio es demasiado que nosotros quieren pagar. Es verdad.
Yes, absolutely. Thank you so much, Raul. I appreciate you so very much.
Thank you, guys.
Ignacio, you also have had the vaccination. Tell us what your thoughts are.
Mary, can you tell me the last name so I can find them?
Ignacio Averol, Averol.
Okay, all set. Thank you.
Okay, can you hear me?
Yes.
Okay, this one's a little different. Well, first, my reason, as Teresa said earlier, my reason was my 73-year-old mother who decided to take the vaccine. And Marcus, I'll try and translate here after I get done. But she took the vaccine without even thinking twice about it. She amazed me because I figured she'd be the first one to struggle with it, but she didn't. And I forgot to say first, Marcus and Mayor Nelson, thank you. Y'all have done a wonderful job downtown. It was quick. My first time through there was 25 minutes. My second time was 35. Wonderful job. Thank you to all of them that are working on that. Bueno, mi razón por agarrar la vacuna fue por mi madre de tercera edad, ya de 73 años. Ella sin duda, sin tener miedo, agarró su vacuna y me sorprendió porque no pensaba que ella iba a agarrar su vacuna. Pensé más que nadie, ella no la agarraba. Y me decidí, si ella lo puede hacer, pues yo también. ¿Qué pierdo? Nada. So when I got my vaccine, again, I mean, I didn't even think twice about it. I've already gone through both doses. My first one was just a little bit achy. My second one, I did experience a little bit more. I had fever and things like that, but I don't regret it. La vacuna primera que tuve, sí me sentía un poco adolorido. La segunda sí un poquito más, con fiebre y algo más, pero no me arrepiento de haber agarrado la vacuna porque para mí es una decisión muy grande y quiero que más mexicanos en el barrio sigan agarrando sus vacunas. Muchas más personas que yo conozco ahora han agarrado su vacuna mirando que uno lo hace y otro lo sigue haciendo. Ellos what's the word, Marcus, for encourage it? Bueno, I'll say this, les da ánimo mirando a más personas agarrar la vacuna y ellos siguen hablando con sus familias. So what I've just said is one of the things I'd like to see in our community here is more of the population here get the vaccine. And one of the things I found is that as more of us get that vaccine, more people jump on board. They become more and more comfortable. So that's one of the things that I do believe will bring out more people in the community. So I'm really glad to hear the transit. I'll post that. I've got several pages that I run on Facebook that I'll post that to. Thank y'all for that. Agradezco mucho lo que ha hecho la ciudad, el alcalde Nelson y Márquez y todos los demás que han hecho todo lo más posible por nuestra comunidad. El RAID lo pondré en varias páginas de Facebook que tengo y más gente pueda mirar y el RAID gratis. Other than that, that's my story. I don't really have a whole lot more. I mean, at first, yes, I was afraid. Being brand new technology, I was not wanting to be the guinea pig, as mentioned earlier. Al principio no quise ser el primero de tomar la vacuna porque pues era tecnología nueva y me asustó mucho y no estaba conforme. But I'm like I tell you, I don't regret it now. No me arrepiento y quiero que mucha más gente siga. Like I said earlier, I want many more people in our community to continue encouraging each other. I think that's how we're going to do this. Thank you.
Thank you.
Ignacio, thank you, Mary. I just have to tell him thank you. I so appreciate your story, and you're right. Thank you for giving support to the vaccine. So, Ignacio, muchas gracias. Es importante para decir tu cuenta y es importante para usar su voz para dar apoyo a las vacunas.
Mayor, muchas gracias. I had no idea you could speak Spanish.
Well, mis verbos son muy malos y Marcos se ríe mucho cuando yo hablo, pero
Igualmente.
yo quiero tratar, ¿sí? Necesito practicar más.
Igualmente, yo también. Me too.
You know, exactly. I was going to say just that, Mayor, that, you know, I think that this forum is really helping to, you know, to ease some fears, to hear from people that have actually gotten it, and to hear why didn't they want to at first, you know, listen to what their fears were, and then also what made them decide to get it. I think that really helps. And so thank you guys again for helping us put this together. So that's the end of our speakers. And so now I am going to take some questions, and I see one has come in. Let me go ahead and read that. The question is, when will people who are not in the 1A and 1B priority groups be able to get the vaccine?
So the state of Texas is who sets those priority groups. Right now we're in 1A and 1B.
So es el estado de Texas ahorita que tiene esos grupos de prioridad que son el grupo 1A y 1B.
There's about 8.4 million Texans who are in 1B, the 1B group.
So hay casi
8.4 million.
8.4 millones de personas aquí que viven en Texas que están de ese grupo 1B, 1A.
And so we'll be in that 1B category for some time, just to take care of all of the Texans who are over 65 or who have high risk medical conditions.
So estaremos ahí en ese grupo por un largo tiempo porque tenemos muchos tejanos que están en ese grupo especial que todavía se necesitan vacunar.
The committee that helps the state decide that continues to meet every week. And I know that this week we'll start talking about what's next. And so there'll be more information to come soon, but we still have citizens who need the vaccine in that 1B group.
En Texas se reúnen una vez a la semana así para decidir así de ese grupo y todavía nos están dando información a nosotros y esperar porque todavía hay muchos tejanos que necesitamos vacunar.
Okay, thank you. So another question is, and I think we've kind of talked about this a little bit, but what avenues are being utilized to inform the Spanish-speaking public about this? You know, again, transportation cost. What is the city doing?
Casey, I can speak to it. We've been doing targeted advertising through zip codes. We've been doing targeted advertising through Facebook and social media. We've also been, all of that social media advertising also automatically translates into whatever language people have set for their social media device, whether it's Facebook, or device is the wrong word, app, whether it's Facebook or other things. We've got them set to automatically translate to whatever language they have set. So we're trying to target our underserved populations. And it's not just our Hispanic populations, but absolutely that's one of them. If there's anything else we can do, we want to be doing it. I know I sound like I'm saying and that's not a good thing to say, but, and I didn't give Marcus a chance to talk. Doggone it, I did it again. Marcus.
No, está bien, nomás Jared Miller nomás quería decir que sí tenemos muchas publicaciones, estamos intentando así poner en ciertos códigos postales aquí por nuestra ciudad, donde así podemos sacar más información a la población, así que lo necesitan más. Sí queremos así que mucha gente así se vacuna, pero así también por otros sitios así sociales como el Facebook y otros medios así, donde la gente así podría ver esos anuncios así en el lenguaje que ellos hablan.
And you can
We're also doing multilingual utility billing stuffers. So anytime someone gets a utility bill, they should be getting also a multilingual stuffer telling them how they can get vaccinations or testing.
So también en los biles así del agua, que también es otro departamento de la ciudad, también están recibiendo así información así en lenguajes así diferentes, con información donde ellos también se pueden así aprovechar de las vacunas y las pruebas del COVID.
And I'm drip and drabbing you, but also the mayor is doing a weekly interview with Telemundo. And she has the great language skills I wish I had, but it's a great tool as well.
So también el mayor, la señora Nelson, está haciendo así, está hablando así con Telemundo así una vez a la semana. So eso también es otro medio que también es bueno por la comunidad, así para ayudarlos con la información que necesitan.
That's great. That's great. Thank you. Thank you. I know that we have reached our hour. I have a few more questions. If you guys don't mind, let me just ask a couple of quick questions. One of them is, can people who are sick or have a common cold get the vaccine?
So it's best that they wait until they're well. So especially if they have symptoms of COVID, then they need to be well. If they do have COVID, they need to be out of that quarantine period, because they don't want those symptoms to mask, or like if they do soreness or maybe even a fever from the vaccine, they don't want that to mask their symptoms of their illness.
So la pregunta al principio era si alguien está enfermo, todavía se pueden poner la vacuna. Y la directora Casey dijo que ahorita no es bueno, así que alguien está enfermo. Si uno está teniendo síntomas así de la gripa o del COVID, también ellos necesitan estar saludables para recibir la vacuna.
They also don't want to, if they do have COVID or like the flu or something like that, then they certainly don't want to spread those germs and make others at the vaccination clinic or the person who's vaccinating them to become sick.
So esa gente así que está enferma, no es bueno ahorita tampoco que salen, que si no pueden estar infectando más personas con la gripe o con el COVID, lo que sea que tienen aquí en un centro de vacunación con nosotros aquí o con una enfermera.
Okay.
So best to wait.
So es
Very
mejor
cool.
esperar.
Thank you. Since there are a report of new strands, is it still crucial that we get the current vaccine?
Absolutely. So the vaccines are most protective against the original strain.
So la pregunta ahorita como están saliendo así con nuevas versiones así del COVID, si es todavía bueno vacunar. La directora dice que sí, que ahorita todavía es bueno así vacunarse uno.
And they do have some efficacy or some effectiveness against the new strains.
y la vacuna todavía tiene cierto eficaz, así con las nuevas variedades así de la enfermedad.
So definitely want to be vaccinated.
So, definitivamente necesitan vacunarse.
Great, thank you. The next question, is this going to be a yearly vaccine like the flu shot?
That's a great question. We don't know yet. Right now, the vaccine is only licensed for like 2 doses for Pfizer and Moderna. And so we have not had any information that would indicate that there would be additional doses.
So, la pregunta era si la vacuna va a ser algo anual, como hacen con la vacuna del gripe. Y la directora Casey dice que por ahorita no hemos recibido así ninguna información sobre eso. Como esta vacuna todavía es nueva, todavía hay poquito más información así que necesitan recolectar para ver si es una vacuna que tendrán que ponerse otra vez.
Okay, great. I don't see any other questions from our attendees. And again, it is a little over an hour. And so I would like to, yes, I was going to say, I would like to give our panelists one last opportunity to talk. So go ahead, Ms. Ginger.
Well, thank you. Muchas gracias. And I can tell that it's very important to our Latino community that they receive information from a source that they trust. Yo creo que es muy importante a la gente de Latino comunidad en nuestra ciudad que se reciben su información de una source que le tienen confianza. Y por eso, so because of this, you can help us by giving us the names of organizations that you interact with in the community, like Wesley. So se pueden ayudarnos por darnos información de grupos que interact o que tienen relaciones con la comunidad latino aquí en la ciudad. Con esta información, la ciudad pueden comunicar con el grupo y el grupo tiene los factos y pueden usar las relaciones para informar la gente, los latinos in nuestra ciudad. So what we want is to increase how this message gets spread out, just like the Wesley has been a conduit of information. Are there other groups in the city that can act as a conduit to our Latino neighbors? So queremos que los vecinos latinos aquí en Amarillo reciben la información de un grupo que les tienen confianza. And so if you know of a group, please call the mayor's hotline. I can't remember how to say no. It's say, si le sé, if you know. How do you say it, Marcos?
No, así dile, como así. You were saying it right.
Okay. Si sé un grupo, por favor, llama the mayor's hotline a las 378-645-6445 y danos la información.
Yes, very good. It's very, very important, as you mentioned, and thank you for offering your hotline number for that. Anyone else? Yes, Jared.
I'm going to give Marcus a chance on this one. I won't talk, and then ask him to translate. But first, my heart, and I know the mayor and Casey and Marcus and everyone else from the city on the call, our heart breaks for Raul's mom, for Raul and his family, and for the loss of his mom.
So, Jared dice que ahorita de parte de nosotros, el mayor Casey y mío, que nuestros corazones ahorita se quebran así por la mamá de Raúl.
I will tell you that anything that you or I or we can do to get the message out to all of our communities that vaccinations can be had, it's readily available. We want to do that.
Él así pide así, si ustedes tienen dónde, quién y cuándo así, qué clase de información así necesitan, que les informe a nosotros, así nosotros sabremos dónde poner esta información, porque es importante así que la gente así se vacune.
My mom is 80 years old. My dad is 82. They live in Birmingham, Alabama. They're on a waiting list that is tens of thousands of people long. They can't get in. They won't leave their house because they're afraid of getting coronavirus. Here in Amarillo, anybody that wants it right now, if they're in group 1A or 1B, like my mom and dad, all they have to do is come and get in a very quick line at the Civic Center. City Transit will take them there. And my mom and dad can't get it. They're afraid to come to Amarillo because they're afraid of the trip. And I'll guarantee you, there are people all over the country that would give their left arm for the opportunity we have here in Amarillo. And if we can get all of our entire population, I don't just want one part of Amarillo at the Civic Center. I want all of Amarillo at the Civic Center. And I want everyone to understand what a great opportunity we have to get the vaccination here, because not everyone has this opportunity.
Jared está hablando sobre su familia y su mamá 80 y su papá que tiene 83, que ahorita viven en otro estado y desafortunadamente están en una lista de espera por la vacuna. No se quieren ir de sus casas así temiendo que se van a infectar, y tampoco no quieren venir acá a Amarillo. Pero lo que Jared quiere explicar es que ahorita tenemos una oportunidad muy, muy grande aquí en nuestra ciudad. Y él quiere no solamente que un parte de Amarillo se vacuna, que todo Amarillo se vacuna. Y que ahorita tenemos algo muy bueno en nuestra ciudad, y tenemos una oportunidad. So, así aquí estamos en Amarillo y quiere que la gente sabe que estamos aquí para que se vacunen.
So thank you for everyone on this call that can help with that mission.
So, gracias a todos que están aquí en esta llamada que pueden ayudar con esto.
Thank you, Jared. Anyone else?
I think we all have a reason that we do these things and a reason that we're in healthcare or in a position that we can serve.
Casey dice que todos que estamos aquí tenemos una razón por qué estamos lo que estamos haciendo, por qué estamos aquí y por qué estamos sirviendo.
My grandparents my grandmother worked in the lab at the hospital, and my grandfather saw patients during the polio epidemics.
So, Casey tiene familia que trabajó así en los laboratorios, y también su abuelo que trabajó así con pacientes que tenían polio.
And my grandmother said that, the fear that was very similar to this when polio was surging through their communities.
Y Casey dice que su abuela también dijo que el miedo era casi igual como está ahorita, con el miedo que muchos tienen así sobre esta enfermedad.
But she also talks about when the polio vaccine was created and was available, that the hope that they felt in their community, and that they didn't have the fear anymore once they became vaccinated.
So ahorita ella dice igual como antes, que ya después que la gente así se vacunaban, ya no tenían las mismas preocupaciones, ya no tenían los mismos miedos que tenían antes que llegara la vacunación.
And so I'm just so proud to be part of a community that is so willing to make sure that everyone in our community has an opportunity to be vaccinated, so that we don't have that fear, and that we can get through this pandemic together.
Casey dice que se siente muy orgullosa ser parte de algo así, y orgullosa así también de nuestra comunidad que ha tomado la iniciativa así a venir a vacunarse, y agradece mucho que ella también puede ser parte de esto.
So thank you for letting us be part of that.
So, gracias por dejarnos hacer parte de esto.
And you know, you guys are doing an amazing job at the Civic Center. And Marcus, you're part of that. You're there every day. Do you want to say anything? Do you have any words of wisdom or you know, anything that you would like to share?
Definitely one of the main things I think I do want to put out there is especially to kind of help break down some of the fear and the barriers individuals might have. I want to touch on documentation. There's a lot of individuals definitely thinking, or at least members of the Hispanic or Latino communities here in Amarillo, who sometimes may fear, you know, documentation, you know, or maybe might fear that, oh, they're going to come, they're going to start asking them for papers, they're going to ask you for documentation, and they just may not have that. And I just want to let them know that, you know, we do not require documentation. They don't have to bring anything with them. They come in, we do ask for specific demographical information, but that's simply just so that we can register the vaccine, so that we can receive their allocation for their second dose. So lo que yo estaba diciendo, una cosa muy importante que yo creo que es algo que necesita, es que ahorita nosotros no estamos requiriendo documentación. So la gente, yo no quiero así que se preocupan creyendo que no tienen documentación y quieren ponerse la vacuna. Nosotros no requerimos nada de información o pruebas de documentación. Todos califican por esta vacuna y es gratis por todos. Sí colectamos poquita información cuando ustedes vienen, pero eso es solamente para asegurarnos que tenemos la vacuna, la segunda, en cuando vienen, porque sí necesitamos documentar esas vacunas así para tener, recibir más del Estado.
Thank you, Marcus. That's a very important point. So I appreciate you. Thank you to our speakers, Mayor, Jared, Casey, Liz, Jerry, and our guests for spending part of your evening with us. We appreciate your willingness to always be available to talk, especially about such important topics such as this. We also want to thank the community members who logged on tonight and tuned in. We hope that you found this information valuable in making the best decision for your health. I would also like to thank the Barrio Neighborhood Planning Committee, the Amarillo Wesley Community Center, who is turning 70 this year. Los Barrios de Amarillo, we are turning 50 this year. Big things are going to be happening in the barrio as always, but this year it's bigger and better. If anybody is interested in knowing what's going on in the barrio, of course, you can find each of our organizations on Facebook. And I know I can speak for all of us whenever I say that we would all love to have you part of our organizations, and we will put you to work. So good night, everybody, and God bless.